If you incorporate these 4 things in your UG, by the time you pass out, the level of clinical skill that you will develop is going to be great. So let's start. A patient with a history of cervical disc herniation had been taking physiotherapy treatment regularly. There was improvement in her symptoms, but one day she came to the OPD with severe pain on one side of the neck. The best thing I thought could be done is to apply a modality. I applied TENS, conventional mode, for 10 to 12 minutes. So I used one channel, one electrode applied over the area that was painful and the other one over here. Though the pain was not there over here, to complete the circuit, I applied it. Now, as soon as I started increasing the intensity, the patient said that she could not feel the current. At first, I thought that it might be because of some fault in the machine. So I changed the electrodes, I changed the cable. But even then, the patient said that she's not able to feel the current. I was confused because the patient did not have any sensory deficit, and even after making sure that the machine is working properly, the patient was not able to feel the current. So then I approached my senior. I asked him as to why all of this is happening. What is the reason for this? So he said that because the pain is severe, the patient has a lot of pain, she is not able to feel the current because central sensitization has taken place. What can be done right now is the electrode that I have applied over here, I need to put it on the same dermatome on the opposite side. Now, how will this help? To some extent, because the electrode is being applied on the affected dermatome, because of irradiation, the patient might have some reduction in her symptoms, in her pain. Now, this solution you will not find in books, neither you will find it on ChatGPT. You will only learn this when you are around people who have more experience than you, who are ahead of you. And that is the reason why it is extremely important to be around such people. If you are in your UG, it is good to be around people who have good clinical skills, who have more knowledge than you, and who can connect things. So if you are in the OPD, if you are in your clinical posting, observe how your seniors treat patients. Observe what are their treatment approaches. How do they solve such problems? What is their thinking process? Now, with this, gradually you will learn to connect things. Books will only tell you what is central sensitization, what is TENS, how to apply it, different modes of TENS. But the patient, whenever a patient comes to you with a particular complaint, how to integrate all of this knowledge and come up with a solution is what you will learn by being with people, and those people who have developed good knowledge, good clinical skill. So therefore, be around people, observe, ask questions, try to understand. Next, and the most important skill is the ability to think critically. I cannot stress enough on the importance of this skill. You will only be able to understand how valuable it is if you have used it. It is like you will only be able to understand how good a mango tastes only if you've eaten it. What is critical thinking? It is questioning things, not accepting them at their face value. Not blindly accepting, but finding out the why. If you have given a particular treatment, why? If you are using this modality, why? If you are seeing this particular symptom, what can be the reasons for it? So asking why and trying to understand the reason behind it. Now, why is critical thinking important? Let's understand this with the help of an example. Imagine you are driving a car and it stops suddenly. What are you going to do? Are you going to just blindly start repairing the engine or start changing the tires? No, right? You will first get down and find out where is the fault. And after you have understood what is the part that is damaged, you will repair that. Similarly, when you are seeing patients, when you are treating patients, it is important to think critically to understand where the problem is, what the problem is, Only when you know what is exactly the cause of the patient's symptoms will you be able to treat. If you don't understand only what the problem is, what are you going to treat? And that is the reason where critical thinking becomes extremely important. If I am seeing a patient with shoulder pain, I need to think as to why the patient is having this pain. What is the reason? What is the diagnosis? And only after I come to a diagnosis that okay, it is adhesive capsulitis, now I will be able to go ahead with the treatment. So if this skill becomes the foundation becomes your foundation at in the early years, it will only strengthen and get better. The best way to learn is to teach whatever you have read. This is the most underrated tool of learning, but it is the most effective. You will retain maximum amount of information whenever you teach that topic to somebody. It does not matter in which year you are, even if you are in your first year, second year, third year, you can use this technique. You can teach your juniors, you can teach your colleagues. You don't have to be a teacher to teach something to someone. Now, how does this learning tool help? When you have read a topic and you teach it to someone, it forces you to think clearly. It is important that you understand that topic first, only then you will be able to teach it to someone. So if you are struggling to to make a person understand what the topic is about, it means you are lacking somewhere. And when you teach a particular topic to someone, it helps in identifying your knowledge gaps. And it is not a weakness but a feedback. You come to know where you are lacking. You can go back, read again, and that is how you strengthen that topic. Compared to a student who has just read the topic, you have an upper hand, because now after reading you have applied it. You have not just read the topic, you have actually understood it. So it is important that whatever you read, try explaining it in bits and pieces to someone. It is not necessary that you need to master that particular topic. You can teach it to your colleagues, you can teach it to your juniors in the postings. Start this early so that your foundation of understanding becomes stronger. Next, don't memorize things. Try to understand. For example, if you are in first year and you are reading the topic classification of movements. Now this is one of the chapters in kinesiotherapy. In this, different movements are described. Active, passive, then under active you have free exercises, active assisted exercises, active resisted exercises. Now the traditional way which many of the students follow is to just go through the theory, open the chapter and start reading it. But a better way to do this is by first understanding what each type of exercise looks like. So for example, if you are in the OPD, if you are in the clinical posting, you are seeing a particular exercise being given to the patient. So start thinking, what exercise is this? This exercise comes under which classification? What is this type of exercise? Is it active? Is it passive? Now when you think that way, you will automatically come up with the next question, which will be, how do I now understand that if it is active or passive? So now you read the theory, you see what differentiates an active exercise from passive. So active exercise is the one where patient does the movement on his own, and passive exercise is the one where an external effort is applied. So now when you look at that exercise being given, you find out, you think whether the patient is doing it on, you see whether the patient is doing it on his own, or is the therapist making the patient do that exercise. If the patient is doing it on his own, then it is an active exercise. Now again, what type of exercise, now what type of active exercise what type of active exercise is it? Is there any resistance being provided? So if the resistance is being given, it comes under resisted exercise. So like this, when you try correlating it with what is being done in the OPD or with real life patients, you will be able to understand things, and then you will not have to memorize anything. You will have to just understand, and that is it. And that is the best way to retain information for the longest period of time. You don't have to keep reading again and again when you've understood something. Now, if you study classification of movements like this, if you try correlating it with examples, you will be able to retain this for a long period of time. So try studying like this for everything that you read. Think how can it be applied? What in the OPD correlates with it? And that is the reason you need to have a good clinical exposure for that also. You need to go to the postings, you need to see how patients are being treated. Only then you will be able to correlate theory with practical.